Okay, okay. Okay, in the yesterday class we completed the, okay. Next, they will go for the coronary circulation. What is coronary circulation? Okay, the coronary circulation, coronary circulation ಪಾಸ್ ಆಗಿದೆನಾ? ಹಲೋ, ಡಿಸ್ಪ್ಲೇ ಆಗ್ತಿದೆನಾ? ಹಲೋ,
हाँ सर.
ಆಗ್ತಾ ಇದೆಯಲ್ಲ? ಓಕೆ. The coronary circulation, it is the one of the blood supply to the heart. Means coronary arteries will supply the blood to the heart muscles. Okay, it is the circulation of blood to the heart. First bronchs of aorta in the coronary artery, which supplies the oxygenated blood to the heart muscles itself. Means the itself they work the contraction relaxation. They have a sufficient blood. That's why they will take the bloods to the heart muscles. But next, conducting system of the heart. What is the conduction system? Means the cardiac conduction. The impulses for the contraction of the heart are transmitted through the conducting system. Okay, what it means conducting system means the impulses generated. What is the generation of impulses and contraction and relaxation? That impulses for contraction of the heart and transmitted through the conducting system of the heart. There are four pathways for the conducting system. First one is the SA node, that is sino-arterial node. Next, arterioventricular node. Third one is bundles of His, and fourth one is the Purkinje fibers. These four are the elements for the pathway for the conducting system of the heart. You see the diagram of the conducting system. It is the SA node, sino-arterial node. They will initiation of the heartbeat. Then that impulses into the AV node. That AV node they will transport it to the bundles of His. This is the left bundles of His and moderate band. Okay, these are the moderate bands. The right bundles branches. They will generate the impulse. Okay, there are the four elements for the conduction of the heart. That is first one sino-arterial node, arterioventricular node, and bundles of His and Purkinje fibers. These four are the first one. Sino-arterial node, it is the specialized cells. The sino-arterial nodes containing a specialized cells in the wall of right atrium near to the opening of superior vena cava. The sino-arterial node is often called as a pacemaker. You know the pacemaker. Pacemaker is the initiation of it is one of the name of sino-arterial node is the pacemaker. Pacemaker because it is initiates the impulses of contraction of the hearts. Means the sino-arterial initiation of the impulses. They will impulses dub is there, no? That is impulses that initiate the beating. Beating means that impulses is converted into electrical impulses. Okay, that impulses initiate the impulses of contraction of the heart contraction. Okay, next, the cardiac action potential spread over the left atrium, causing them to contract. Blood enters into the ventricles. This process, the cardiac action potential spreads over the right and left atrium, causing them to contract. Blood enters into the ventricles. Next, arterioventricular node, it is specialized cells that situated in the wall of the interseptum near to the arterioventricular openings. The interseptum, there are two types of arterioventricular septum, and another one is, what is another one? Hello? The arterioventricular node, it is specialized cells situated on the wall of the intraventricular septum near to the arterioventricular opening. Next, impulses of the sino-arterial node passes to the sino-arterial node to the arterioventricular node. Next, third one is the You see the diagram, the sinoatrial node, they will impulses, they will transmitted to the AV node. After the AV nodes, they will divided into two bundles of His. Okay, you see the diagram. Okay, next, bundles of His. It is a specialized mass fiber, okay, that originated from the AV node, which further divided into left and right branches. In the Purkinje bundles of His, that the SA node is converted in the impulses generated to the transmitted to the AV nodes. After AV nodes, the bundles of His, they are divided into two left and right, further divided into left and right, breaks into the two, okay, two branches, converted into breaks into the two branches. Okay, next, Purkinje fibers. In the Purkinje fibers, the right and left branches of bundles of His breaks up into the fine fibrous called fine fibrous. This is okay. Bundles of His branches, the right and left branches of bundles of His breaks up into the fine fibrous called is a Purkinje fibers. That is known as a Purkinje fibers. These fibers convey the impulses of contraction, from the AV node to the entire ventricle system. Entire ventricle system. Okay, these fibers convey the impulses, means they convey the impulses of contraction from the AV node to the entire ventricles. Thus, entire sequence of conduction takes place. That is known as a conduction system of the heart. Okay, you see the animated diagram of this conducting system. Okay, next is the cardiac cycle. Okay, what is cardiac cycle? Cardiac cycle refers to the sequence of events that takes place when the heart beats. Okay, what is cardiac cycle? Means the generated the heart beats. That cycle refers to the sequence of events that takes place when the heart beats. The cardiac cycle attributes to the comprehensive heartbeats from its production to the commencement. Its production to the commencement of the next beat, means the heartbeat will generated in the SA node or pacemaker. Okay, that cardiac cycle attributed to comprehensive heartbeats from its production to the commencement of the next beat. It comprises diastole, the systole. Diastole means dilution, systole means contraction. Contraction and dilution takes place. That intervening the pause, means at the time of diastole and systole, the center of the between diastole and systole, that is the intervening pause. Okay, that occurrence of the cardiac cycle is illustrated by the heart rate, which is naturally indicated as beats per minute. Means the occurrence of cardiac cycle is illustrated by the heart rate, which is naturally indicated as beats per minute. A healthy human heartbeat 72 times per minute, which states that there is a 72 cardiac cycles per minute. Means these beats are one beat. Okay, that is one cycle, that is 72 cardiac cycle per minute. The cardiac cycle involves a complete contraction and relaxation. Means contraction means systole, relaxation means diastole. Okay, on both atria and ventricles. The cycle lasts approximately 0.8 seconds per cycle. 0.8 second per one cycle. Okay, take time to the 0.8 second per one cycle. You see the cardiac cycle phases of the cardiac cycle. Following are different phases that occurs in the cardiac cycle. You see the diagram of cardiac cycle. First one is the atrial contraction, atrial dilation. Here you see the diagram of, okay, atrial systole begins. This is first atrial systole. This is first. Here some mistake is there. First one is the atrial systole. The atrial systole means that begins the The cardiac cycle starting point, it is arterial contraction means the arterial contraction takes place. Okay. This next second one is the isovalmic contraction. It is isovalmic contraction. You see the diagram. First one, the arterial contraction takes place after the isovalmic or isovalmetric contraction. Isovalmetric contraction means the blood goes to the ventricles to the atrium. Okay, this is the position. You see the arrow marks here. Here inside the ventricles. Okay, inside the ventricles here. Inside the ventricle. Okay, here inside the atrium. Here inside the atrium. Here outside the ventricle. Okay, this is the process of arterial systole. This is cycle. This is next is the ventricular systole. After the isovalmic contraction takes place, after the isovalmic contraction, the ventricular contraction takes place. Here, ventricular contraction takes place. The bloods comes out from the ventricle. Okay, that is ventricle ejaculation. Okay, ventricular systole, second phase. This is the second phase. The isovalmic contraction and ventricular contraction. This is the phase of ventricular systole. Next, third phase is the isovalmic relaxation. Isovalmic relaxation, that is ventricular diastole. Diastole means dilution. Okay, here dilution takes place. After the dilution takes place, the ventricular filling. The filling in the ventricular, that is known as a ventricular filling, that is known as a ventricular diastole. This is the process of the phase of ventricular diastole at late. Okay, next, finally once again there will arterial contraction. These cycles occurs in the 0.8 seconds. One cycle continue the 0.8 second. Total 1 minute containing 72 cycles. Okay, these are the phases. This is the very important question for the examination. Okay, these are the, you write the 6 phases. After 6 phases you write the diagram. Okay, it is easily remind you. Okay, easily remembering or easy cycle, but you write in your own language. Okay, next, the duration of the cardiac cycle, as usual, know the 72 beats per minute. Okay, in normal persons the heart beats 72 beats per minute. So the duration of one cycle can be calculated as 1 divided by 72. Okay, per minute. Okay, 0.139 minutes per beat. Okay, 0.139 minutes per. The heart beats 72 beats in a minute. Duration of each cardiac cycle which be a 0.8 seconds. Okay, 0.8 second. The duration of different stages of the cardiac cycle is given below. First one is the means the duration. How what are the duration takes place in the how much time to take the duration of the first one is the arterial systole. The continuous for the 0.1 second. Ventricular systole 0.3 seconds. Arterial diastole continue for the 0.7 seconds. Okay, next ventricular diastole continue for the 0.5 second. Okay, this process continue the cardiac cycle, take the time to the arterial systole, ventricular systole, arterial diastole and ventricular diastole. Systole means the contraction takes place. This is the contraction. Okay, this is the relaxation. You see the diagram of the animated diagram. You see the animated diagram, that is the occurs in the cardiac cycle process. You see the diagram. Okay, yes, ಕೇಳಿಸ್ತಾ ಇದೆಯಲ್ಲ ಎಲ್ಲರಿಗೂ? ಹಲೋ 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 ಕೇಳಿಸ್ತಾ ಇದೆಯಲ್ಲ? ಅದಕ್ಕೆ ನೀವು ಮಾತಾಡಿದ್ರೆ ನನಗೆ ಗೊತ್ತಾಗುತ್ತಿಲ್ಲ ಅಂದ್ರೆ ನನ್ನ ಪಾಡಿ ನಾನು ಹೋಗ್ತಾ ಇರ್ತೀನಿ. Next, cardiac output. In the main examination they will ask for the 4 definition: cardiac output, stroke volume and heart rate. They will easily ask for 4 marks or 3 marks, 2 marks or 4 marks maximum. The 4 definitions will ask in the question, 4 marks question. Okay, the first one, cardiac output. What is cardiac output? The amount of blood that heart pumps through the circulatory system in a minute. 1 minute, take a 1 minute, that is the cardiac output. The amount of blood that heart pumps through the circulatory system in a 1 minute. Okay. Next, second one, stroke volume. What is the stroke volume? The amount of blood put out by the left ventricle, of the heart in one contraction is called as a stroke volume. Means in the stroke volume, the amount of blood, put out by the left ventricle of the heart in one contraction, that is called as a stroke volume. Next, heart rate. What is heart rate? Your pulse rate, as also known your heart rate, same, both are same. Okay, in the number of times your heartbeat per minute, a normal resting heart rate should be between 60 to 100 beats per minute. Means between the heart rate, that is heart rate and pulse rate nearly similar. Okay, your pulse rate, it is also known as your heart rate in the number of times heartbeat per minute. A normal resulting heart rate should be between 60 to 100 beats per minute, but it can vary from the minutes to minutes. Means this minutes that 72, next minute the 70 to 80, 82, 90, 92. That's like, okay, that's like they will minute by minute they will differentiate different beats. Okay. Next, the stroke volume. The stroke volume and the heart rate determine the cardiac output. Means the stroke volume will determine the heart rate. Stroke volume and heart rate determine the cardiac output. Means the cardiac output will determine the volume of the stroke volume and heart rate. Okay. The normal adult has cardiac output of the 4.7 liters. Means the normal adult has cardiac output contains 4.7 liters per quarts of the per minute. Means supply of the blood to the 4.7 liters pumped blood to the heart is blood to the 1 minute time. Okay. You see the diagram. This is the cardiac output and stroke volume into heart rate. The cardiac output, the 5040 ml per minute, means that the cardiac will pump only how much quantity of ml of blood will pump. 5040 means 5040 ml of blood will pumped the heart in a minute. Okay, 70 in the stroke volume 70 ml and heart rate is the as usual 72 per minute. You see the diagram of animated diagram, that is the cardiac output. Okay. Next is the electrocardiogram. What is electrocardiogram? Okay. The electrocardiogram is the test that measures the electrical activity of the heartbeat. Means the electrocardiogram is the instrument. It is measured the electrical activity of the heartbeat. Means the heartbeat containing lub dub, that lub dub containing electrical impulse, that is you see in the diagram, you see the PQRS interval. Okay, this intervals the electrical activity, this intervals comes, this is the normal heart beating. Okay, this PQRS will differentiate that causes the diseases like disorders of the cardiovascular system, they will explain you. Okay, next the electrocardiogram is the test that measures the electrical activity of the heartbeat with each beat. Okay, the each beat in the normal persons, each beat will the same electrical impulses P, Q, R, S, T. This is the normal value beating. PR interval, PR segment, ST segment, QRS complex. Next, QT interval. These are the normal intervals for the heart beat. Okay. The electrocardiogram, it is the test measures the electrical activity of the heartbeat with each beat and electrical impulses or waves travels through the heart. These waves cause the muscles to sequence and pump blood from the heart. First one is the ECG recording as designed by the letter of PQRST. Okay, the wave P represented arterial contraction. The P is the arterial contraction. Next, wave QRS represented as a ventricular contraction. This is the arterial contraction. This is the ventricle contraction. Okay, the more than arterial contraction, more than that means 0.7 seconds. This is okay. Arterial contraction, ventricular contraction takes 0.7 seconds. Okay, here next, wave T represented as a ventricular relaxation. This is the T, ventricular relaxation. Okay, in the arterial contraction this same and ventricular relaxation both are same. In the QRS interval they have more, okay, more electrical energy and more beating, okay, takes place. You see the electrocardiogram reading. Okay, electrocardiography is the process producing the electrocardiogram, means the heartbeat is converted into electrical impulses. Okay, you see the diagram. This is the normal beating of the heart. Okay, this is the normal beating. In any lines continue, they will no beating. Okay, here is there is no beating, means the persons will not live. Okay, this is normal beating contains normal live person. Okay, in the line contains there is no beating. Okay, next blood pressure. What is blood pressure? Okay, blood pressure is the pressure of circulating blood against the wall of the blood vessels. Okay, the blood pressure, it is pressure of circulating blood against the wall of the blood vessels. The term as a blood pressure refers to the pressure in the large arteries. It is seen in the large arteries. Okay, there are two types of blood pressures. There is a two types of blood pressure. First one is the systolic blood pressure. Second one is the diastolic blood pressure. Systolic, you know, the systolic means contraction. Diastolic means relaxation. Okay, the systolic BP. In the systolic BP, the maximum pressure during the systole is 120 mmHg. Okay, the maximum pressure during the systolic BP, that is 120 mmHg, means mmHg. Okay, next, diastolic blood pressure. Diastolic blood pressure means minimum pressure during the diastole is 80 mmHg. 80 mmHg. Normal blood pressure, it occurs systole and diastole. The systolic is a 120 bar, diastole is a 80 mmHg. That is the normal blood pressure of the person. Next, pulse pressure. Pulse pressure means it is the difference between systolic and diastolic BP. That is the pulse pressure. How to recording the BP. You see the diagram of the how to monitoring the blood pressure. We are using the sphygmomanometer, is the device of measure the blood pressure. Okay, it is also commonly known as a BP apparatus. It is specific name of sphygmomanometer. Sphygmomanometer is a device that measures the blood pressure. It is composes of a inflatable rubber cuff. This is the rubber cuff. Okay, rubber cuff which is wrapped around the arm. A measuring device indicates the cuff's pressure. It will generate the cuff pressure, that the bulb inflates the cuff and the valve of released pressure. Okay, valve of released pressure. The stethoscope is used to listen the arterial blood flow sound, means in the blood pressure you will rise, the cuffing takes place. That time what happens, their cuffing pressure and inside of your blood arteries, that one sound will generate. That is tug 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 tug. That sound is the stethoscope containing that sound. That is the maximum pressure. In below 80 to 100 to 80, that pressure once again they will sound dub 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 or tuck 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 tuck. So they will sound comes. That is the minimum. Sorry. Next, significance. What are the significance? Sorry. The measuring blood pressure. Okay, it is a recording of the BP. That is the significance. Measuring the blood pressure, monitoring the effectiveness of the medications. Next, helps to control the hypertension. What is hypertension means? What is hypertension? Increases the elevated blood pressure, increased blood pressure. Okay, increased blood pressure, that is the hypertension. Okay, it helps to detect the various diseases of the heart diseases. Okay, the BD, that is contraction and relaxation, takes place in the differentiation. Okay, the more than the beating or more, that time the BP will increases and decreases. That is the condition low BP or high BP. They will measured by this instrument. Next, artery and venous system. Arterial and venous system. The arterial system is a higher pressure portion of the circulatory system. Means, you see the diagram, it is blue color is there, that is deoxygenated blood. Okay, that is veins. In the red color is there, that is the arteries. Okay, artery containing oxygen blood, veins containing deoxygenated blood. Okay, next, the arterial system is higher pressure portion of the circulatory system, with pressure varying between the peak pressure during the heart contraction, that is known as a systolic pressure, that minimum diastolic pressure between the contraction when the heart expands and refills. Okay, heart expands and refills. The venous system is that a part of circulation in which the blood is transported from periphery back to the heart, peripheral system to the heart. We distinguish between the superficial and the deep venous system. There are two types of venous system. First one is the superficial venous system and deep venous system. The types of there are two types of circulations. First one is the pulmonary circulation. Okay, next, systemic circulation. What is pulmonary circulation? The pulmonary circulation, what is pulmonary organ? What is pulmonary organ? That is, pulmonary organ is the lungs. Okay, the purification of blood, or they will what happens in the oxygen molecules combined with the hemoglobin. Okay, in the lungs only. Okay, the pulmonary circulation is the portion of the circulation responsible for carrying deoxygenated blood away from the heart. Means, carrying the deoxygenated blood from the heart and once again to the lungs, then brings oxygen blood back to the heart. Means, the oxygen molecules, they are combined with the hemoglobin. You know the hemoglobin estimation, that the concentration of hemoglobin increases, the oxygen carrying capacity will be increases. Okay, that is coming under disease. Okay, the lungs then brings oxygen blood back to the heart. Next, systemic circulation. The systemic circulation, it is another portion of the circulation where the oxygenated blood is pumped from the heart to every organ and every cell of the body. Okay, this systemic circulation takes place. They are the blood pumped to the every part of the, or every minute molecules of the cell. Okay, they will pump. Okay, next, this tissues in the body. Okay, the deoxygenated blood comes back again to the heart. This, after the completion of oxygenated blood, go into the cells. After the deoxygenated blood comes to the heart. That is deoxygenated blood. Okay. Next, what is the function of the heart? Anyone? What is the functions of heart? Tell me, anyone? Idira? Okay. Here, a function of the heart. Okay, function of the heart. There are four main functions of the heart. First one is the pumping oxygenated blood to the other part of the body. Second one is the pumping hormones and other vital substances to the different part of the body. Okay, the first function is the pumping oxygenated blood to the other part of the body. Next, pumping hormones and nutrients. Okay, other vital substances to different part of the body. Next, receiving the deoxygenated blood and carrying the metabolic waste products. Like, what are the metabolic wastes? After completion of the metabolism, that metabolic wastes are receiving, okay, product from the body and pumping it to the lungs, okay, carbon dioxide. These are of the oxygenation, okay. The receiving oxygenated blood and carrying metabolic waste products from the body and pumping it to the lungs for oxygenation. Next, third one is the maintaining of the blood pressure. These are the 4 functions of the heart, okay. Next, the disorders of heart, okay, or disorders of the cardiovascular system. First one is the coronary artery disease. Coronary artery disease. What is coronary artery disease? Over the year of cholesterol plaques, okay, the accumulation of cholesterol in the coronary artery, that accumulation takes place. The diameter, when compared to the normal coronary artery, they will form a cholesterol flake form. Means the diameter of the coronary artery is decreased when compared to the normal. That time what happens? The cholesterol flakes can narrow the arteries. Supplying of blood to the heart will, comparing to normal, very less. That time what happens? The more pressure created by the heart, okay, that occurs. Hello, 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 hello. ಹಲೋ, ಕೇಳಿಸ್ತಾ ಇದೆಯಾ? ಹಲೋ ಹಲೋ ಹಲೋ, ಕೇಳಿಸ್ತಾ ಇದೆಯಾ? ಹಲೋ, ಕೇಳಿಸ್ತಾ ಇದೆ, ಓಕೆ.
ಹಾಂ ಸರ್.
The disorders of the heart. First one is the coronary artery disease. Okay, that is cholesterol plaque can narrow the arteries supplying blood to the heart. That narrowed arteries are higher risk for the complete blockage from the sudden blood clot. This blockage causes the heart attack. That is the coronary artery diseases. Next, stable angina pectoris. Angina pectoris, the narrowed coronary artery causes the predictable chest pain. It occurs in the chest pain, center of the chest, that is pain occurs, okay, or discomfort with excitation. Discomfort with the excitation. The blockage prevents the heart from the receiving the extra oxygen needed for the strenuous activity. Symptoms typically get better the rest. Means the chest in the stable angina, that causes the insufficient supply of oxygen to the, okay, insufficient oxygen to the heart. Otherwise, that is discomfort, causes the chest pain, okay. That is condition is the stable angina pectoris. Next, third disorder of the unstable angina pectoris, okay. That unstable angina, both are coming under the angina pectoris, stable and unstable. The unstable angina pectoris, the chest pains or discomfort that is new worsening or occurs in the rest. This is emergency situation, okay, as it can produce heart attack, okay, proceed heart attack or serious abnormal heart rhythm. Means rhythm or cardiac arrest. Rhythm means the irregular heart, abnormal heart beating. The heart beating normally, that is 72 per minute or more than 72, 80, 85, 90, 100, 120, 130, 150. Okay, this is the condition that a unstable angina. That time the more heart beating, irregular heart beating, that causes the chest pain. Next, third one. Fourth one is the myocardial infarction. This is the one of the disorders of the heart. That is known condition is the heart attack. The coronary artery is sudden blocked. In the coronary artery diseases, what happens in the myocardial infarction? That coronary artery is suddenly blocked. At that time, heart have starved of the oxygen part of the heart muscles die. Means the coronary artery is very important role in the supply of the blood to the heart. Okay, heart muscles. That suddenly blocked occurs in the coronary artery. That what happens? The sudden death of the heart muscles. What happens? The heart muscles are death. What happens? They will struck the beating will be stopped. That is the condition is known as a myocardial infarction. That is means the sudden death of the heart muscles. Next, arrhythmia. Arrhythmia. What is arrhythmia? This is arrhythmia. Arrhythmia means that is abnormal heart rhythm due to the changes in the conduction of the electrical impulses through the heartbeat. Means that a normal heartbeat is the lub dub lub dub. That is condition lub lub dub 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 dub. The difference between the more beating also lub dub more beating. That time what happens? The abnormal heart rhythm due to the change in the conduction of electrical impulses will in the graph of the electrocardiogram, that will PQR intervals, okay, PQR ST intervals, they will differentiate it. Means correlate, not a normal beating, that is increases the heartbeats. That have what happens? The PQRS interval will be differentiated. Means they are not seen in the normal waves. Okay, that increases the PQR interval or decreases the T interval or more than P. That's like in the irregularity of the rhythm that happens in the arrhythmias. Means arrhythmia is the irregular heart beating. That is condition of irregular heart beating. But some arrhythmias begins, okay, but others life threatening. Means throughout the life they will suffering from this arrhythmia. Okay, next, congestive heart failure. This is the condition of disorders of the heart, congestive heart failure. The congestive heart failure is either too weak or too stiff to effectively pump blood throughout the body. Shortness of the breath, leg swelling are a common symptoms of the congestive heart failure. But congestive heart failure means it is too weak, too stiff. The effective pump means the pumping is not effective pumping. Okay, the less pumping through the body, shortness of breathing and leg swelling. Okay, leg swelling, that is the common symptom of the congestive heart failure. Next, cardiomyopathy. What is cardiomyopathy? A disease of heart muscle in which the heart is abnormally enlarged, thickened. Okay, the abnormally enlarged and thickened, stiffened. As a result, the heart ability to pump is weak. Means in cardiomyopathy, the enlarged heart, the insufficient pumping. Okay, it is not a normal heart ability. Their ability to pump means weakened. Next, myocarditis. Myocarditis means inflammation of the heart muscles, most often due to the viral infection. Some viral infection causes the myocarditis, means inflammation on the heart muscles. That is the one of the disorders of the heart. Next, pericarditis. Pericarditis means in the inflammation of the lining of the heart. You know the pericardium. Pericardium is the lubricating or outer covering of the heart that causes the lining of the heart, that any viral infections or kidney failure, at the time of kidney failure and or autoimmune conditions are common causes. The pericarditis, inflammation of the lining of the heart muscles. Okay, heart, lining of the heart, pericardium, the viral infection and kidney failure, that time they will cause this disorder. Next, pericardial effusion. Pericardial effusion means the pericardial effusion, the pericardium containing the layer of the fluid, that fluid between the lining of the heart, pericardium, okay, and that heart itself, often it is due to the pericarditis. In the condition of pericarditis, the inflammation of the lining, okay, or heart muscles, that condition pericardial effusion. Next, arterial fibrillation. What is arterial fibrillation? Arterial fibrillation is the condition of abnormal electrical impulses. In the electrical impulses are the abnormal, it is atria causes the irregular heartbeat. The atria causes the irregular heartbeat, that is known as a arterial fibrillation. It's one of the most common arrhythmias. Next, pulmonary embolism. What is pulmonary embolism? Typically, a blood clots travels through the heart to the lungs. Means the pulmonary veins and pulmonary artery, after the clotting, blood travels through the heart to the lungs. That happens in the pulmonary embolism. Next, heart valve disease. The heart valve disease, there are 4 heart valves. Each can develop the problems if severe valve disease causes the congestive heart failure. Next, the heart murmur. Okay, what is heart murmur? The abnormal sound heard when listening the heartbeat with the stethoscope. Means murmur means the abnormal sound occurs. The normal sound is the lub dub lub dub. That abnormal sound occurs, that is the listening of the heart with the stethoscope. Some heart murmur or begins, other suggested to the starting of the heart diseases. The endocarditis. Next, one of the endocarditis, that is inflammation of the inner lining of the heart valves of the heart. Usually endocarditis is due to the serious infection of the heart valves. The serious infection of the heart valve. Next, mitral valve prolapse. What is mitral valve? Means bicuspid valve. Okay, that bicuspid valve prolapse means the bicuspid valve is forced backward slightly after blood has passed through the valve. That time causes the any deficiency of this mitral valve, insufficient opening and closing that valves. That is condition is the mitral valve prolapse. Sudden cardiac death. This finally sudden cardiac death means the death causes by the sudden loss of heart failure or cardiac arrest. Finally the cardiac final disorder is the cardiac arrest, means sudden loss of the heart function, that is the cardiac arrest. These are the disorders of the heart or cardiovascular system. The very important chapter for your syllabus will be complete. Okay, thank you for the supporting of the online classes to all the students. Okay, thank you for supporting the online classes. The regular classes are started, but you are not coming to the college with the means some of the students not vaccinated, that's why. Okay, all are vaccinated. How many are vaccinated today? No one,